Question 1. Which of the following is an essential role of community health nurses in a disaster response? A. Conducting triage. B. Providing financial aid. C. Educating the public on disaster preparedness. D. Managing legal cases of the disaster victims. Answer. C. Educating the public on disaster preparedness. Rationale. Community health nurses play a vital role in educating the public about disaster preparedness, which helps mitigate the impact of disasters. The other options, A, B, D, are more suited to other professionals, such as doctors and legal experts. Question 2. What is the primary goal of public health nursing in underserved communities? A. Providing curative care. B. Promoting primary health care and disease prevention. C. Administering medication. D. Performing surgical interventions. Answer. B. Promoting primary health care and disease prevention. Rationale. The primary goal of public health nursing in underserved communities is to promote health and prevent disease. Option A, providing curative care, is not the main focus of public health nurses in these settings. Question 3. How does a community health nurse assess the needs of a population? A. Through medical testing. B. By observing individual patients only. C. Using surveys, interviews, and public health data. D. By reviewing hospital records only. Answer. C. Using surveys, interviews, and public health data. Rationale. A comprehensive assessment of a population's needs involves collecting data from various sources, such as surveys and public health reports. Options A, B, and D are too limited for a full community assessment. Question 4. Which factor is most important in identifying a community's health risk factors? A. The availability of healthcare professionals. B. The socioeconomic status of the population. C. The physical infrastructure of the community. D. The political affiliations within the community. Answer. B. The socioeconomic status of the population. Rationale. Socioeconomic status is a critical factor that can influence a community's health risks, such as access to care, nutrition, and living conditions. Other factors, like health care availability or infrastructure, are secondary. Question 5. What is the best approach for a public health nurse to use when prioritizing community health interventions? A. Focus on the most acute health issues. B. Provide equal resources to every health issue. C. Focus on issues that will affect the largest number of people. D. Prioritize health problems based on the severity of symptoms. Answer. C. Focus on issues that will affect the largest number of people. Rationale. Prioritizing health interventions based on the population impact allows the nurse to address the most pressing issues efficiently. Option A focuses on individual acute care, not population-wide impact. Question 6. Which of the following actions would best promote health equity in a community? A. Providing free health screenings to the entire population. B. Distributing health education materials equally across all communities. C. Targeting interventions for at-risk groups based on specific social determinants of health. D. Offering community-wide vaccinations without considering individual needs. Answer. C. Targeting interventions for at-risk groups based on specific social determinants of health. Rationale. Health equity focuses on addressing the needs of at-risk groups based on factors like income, race, and geography. Options A and B, while beneficial, do not specifically target health disparities. Question 7. What is an example of primary prevention in public health nursing? A. Administering flu vaccines to children. B. Treating hypertension in the elderly population. C. Counseling a patient on weight loss after a heart attack. D. Screening for breast cancer in women over 40. Answer. A. Administering flu vaccines to children. Rationale. Primary prevention aims to prevent disease before it occurs. Vaccination is an example of primary prevention, whereas the other options are secondary or tertiary prevention. Question 8. Which of the following is an ethical consideration when working with vulnerable populations in public health? A. Maintaining strict confidentiality about a patient's medical history. B. offering the same care regardless of individual circumstances. C. Encouraging patients to make decisions based on the nurse's personal values. D. Ignoring cultural differences when planning care. Answer: A. Maintaining strict confidentiality about a patient's medical history. Rationale: maintaining confidentiality is a fundamental ethical principle in nursing, especially when working with vulnerable populations. The other options violate ethical standards. Question 9. How can community health nurses contribute to disease prevention in rural areas? A. By offering transportation for patients to access care. B. By developing educational programs about hygiene and nutrition. C. By only providing emergency care when needed. D. By minimizing collaboration with local healthcare workers. Answer: B. By developing educational programs about hygiene and nutrition. Rationale: education is key in disease prevention, especially in rural areas with limited resources. Options A and C focus on reactive care, and D contradicts the need for collaboration. Question 10. Which method is effective in evaluating the success of public health nursing interventions? A. By analyzing changes in disease rates and health behaviors. B. By asking the nurse's supervisor for an opinion. C. By conducting informal interviews with family members. D. By reviewing anecdotal evidence from the community. Answer: A. By analyzing changes in disease rates and health behaviors. Rationale: measuring health outcomes through data like disease rates and health behaviors provides objective evidence of the intervention's success. Question 11. What is the role of a public health nurse in disaster preparedness? A. Providing financial assistance to families affected by disasters. B. Teaching communities how to respond to various emergency situations. C. Organizing disaster relief teams and providing treatment. D. Offering grief counseling to victims. Answer: B. Teaching communities how to respond to various emergency situations. Rationale: educating communities on disaster preparedness helps them respond effectively. Financial assistance and counseling are important, but not the nurse's primary role in preparedness. Question 12. Which of the following would be considered a secondary prevention strategy in public health nursing? A. Providing smoking cessation programs to high-risk individuals. B. Administering vaccines to prevent disease outbreaks. C. Offering health screenings to detect early signs of illness. D. Encouraging regular exercise to prevent chronic conditions. Answer: C. Offering health screenings to detect early signs of illness. Rationale: secondary prevention aims to detect diseases early. Smoking cessation and exercise are primary prevention strategies, and vaccination is also primary prevention. Question 13. What is a core function of public health nursing in addressing environmental health concerns? A. Enforcing local environmental laws. B. Conducting research on the environmental impact of pollutants. C. Advocating for policies that reduce environmental hazards. D. Providing direct medical care to individuals affected by environmental toxins. Answer: C. Advocating for policies that reduce environmental hazards. Rationale: public health nurses advocate for policies that address environmental risks. Direct care and research are important, but secondary functions. Question 14. Which of the following is a public health nurse's responsibility in reducing health disparities? A. Ignoring the cultural backgrounds of the patients when planning care. B. Ensuring equitable access to healthcare services for all individuals. C. Focusing only on high-risk groups without considering the broader community. D. Ensuring that healthcare is provided exclusively in urban areas. Answer: B. Ensuring equitable access to healthcare services for all individuals. Rationale: reducing health disparities involves making healthcare services accessible to all, regardless of background. Ignoring culture or focusing only on certain groups is not inclusive. Question 15. What is the most appropriate nursing intervention for a community with a high prevalence of smoking? A. Administering nicotine replacement therapy to all residents. B. Educating the community about the risks of smoking and providing resources for smoking cessation. C. Providing a free supply of cigarettes to encourage smoking in moderation. D. Offering individualized counseling to non-smokers only. Answer. B. Educating the community about the risks of smoking and providing resources for smoking cessation. Rationale. Community-wide education and resources for quitting smoking are key to public health interventions. Other options are inappropriate or too focused on specific individuals. Question 16. What is the first step in developing a community-based health intervention? A. Implementing the intervention immediately. B. Identifying the specific health needs of the community. C. Conducting a survey of healthcare workers. D. Creating a budget for the program. Answer. B. Identifying the specific health needs of the community. Rationale. Identifying community health needs is the first step in creating an effective intervention. The other steps come after assessing needs. Question 17. How does the Healthy People Initiative guide public health nursing practice? A. By outlining specific national goals for improving health. B. By recommending specific medications for treatment. C. By identifying local resources for community health initiatives. D. By outlining budget requirements for healthcare services. Answer. A. By outlining specific national goals for improving health. Rationale. The Healthy People Initiative provides national health goals that guide public health practice. The other options are not relevant to the initiative's purpose. Question 18. What is a key strategy for addressing mental health in the community? A. Encouraging individuals to avoid seeking professional help. B. Creating programs that promote mental wellness and provide access to counseling. C. Ignoring the mental health needs in favor of physical health issues. D. Offering medication-only solutions. Answer. B. Creating programs that promote mental wellness and provide access to counseling. Rationale. Promoting mental wellness and offering counseling services are essential for addressing community mental health needs. Question 19. How can a public health nurse contribute to improving immunization rates in a community? A. By providing free vaccines to all individuals regardless of need. B. By educating the community on the importance of vaccines and dispelling myths. C. By requiring that everyone in the community receives vaccines. D. By focusing only on children's vaccinations. Answer. B. By educating the community on the importance of vaccines and dispelling myths. Rationale. Education and addressing misconceptions about vaccines are essential strategies for improving immunization rates. Question 20. Which of the following actions best promotes health literacy in a community? A. Offering complex medical jargon in health education materials. B. Providing clear, accessible, and culturally relevant health education. C. Focusing solely on online health resources. D. Using only written materials and excluding other forms of communication. Answer. B. Providing clear, accessible, and culturally relevant health education. Rationale. Health literacy is promoted when information is clear, accessible, and culturally appropriate for the community. Complex language or only written materials may hinder understanding. Question 21. In addressing the healthcare needs of rural communities, which of the following interventions would best improve long-term access to care? A. Building additional clinics to treat acute conditions. B. Implementing a comprehensive telehealth infrastructure alongside training for local healthcare workers. C. Offering financial incentives only to primary care physicians. D. Sending healthcare professionals on periodic rotations from urban centers. Answer. B. Implementing a comprehensive telehealth infrastructure alongside training for local healthcare workers. Rationale. Telehealth, coupled with training for local providers, addresses long-term healthcare needs in rural areas. The other options are more short-term solutions. Question 22. How can public health nurses ensure that the results of community-based participatory research are actionable and lead to sustainable health improvements? A. By allowing only health professionals to make decisions on interventions. B. By continuously involving the community in planning, implementation, and evaluation phases. C. By focusing solely on the scientific data without involving community input. D. By implementing health strategies based on general population needs rather than specific community concerns. Answer: B. By continuously involving the community in planning, implementation, and evaluation phases. Rationale: community-based participatory research requires community engagement throughout the process to ensure that health interventions are culturally appropriate and sustainable. Question 23. Which of the following actions would best foster a population-wide shift toward preventive health behaviors in a community with a high prevalence of chronic disease? A. Launching a mass media campaign promoting individual responsibility for health. B. Developing collaborative community programs that integrate social support, education, and access to resources. C. Providing financial incentives for individuals to undergo routine health screenings. D. Focusing on improving healthcare infrastructure to treat chronic diseases rather than prevent them. Answer: B. Developing collaborative community programs that integrate social support, education, and access to resources. Rationale: sustainable behavior change is best achieved through comprehensive programs that address both individual and social factors influencing health. Question 24. When conducting a community health assessment in an urban area with high health disparities, which step is critical for identifying the most urgent health needs? A. Reviewing hospital discharge data without considering the community's direct input. B. Gathering data on social determinants of health, income, education, housing, and incorporating community perspectives. C. Focusing only on the most prevalent diseases in the community. D. Evaluating the physical environment without considering the community's access to healthcare. Answer: B. Gathering data on social determinants of health, income, education, housing, and incorporating community perspectives. Rationale: health disparities are deeply rooted in social factors, and addressing them requires understanding the broader context, including community input. Question 25. What is the most effective strategy a public health nurse can use to reduce maternal mortality in a community with limited access to healthcare? A. Conducting mandatory prenatal screenings at local clinics. B. Building partnerships with local community organizations to increase prenatal education and transportation to clinics. C. Encouraging women to deliver at home with assistance from midwives. D. Providing free medical services only to women who are already pregnant. Answer: B. Building partnerships with local community organizations to increase prenatal education and transportation to clinics. Rationale: the most sustainable solution involves engaging community partners to address the root barriers to care, such as transportation and education. Question 26. What approach is most likely to help public health nurses address the environmental health challenges faced by disadvantaged urban communities? A. Implementing policies that solely regulate waste management practices. B. Educating residents about the risks of environmental hazards, coupled with advocacy for policy changes. C. Focusing only on indoor air quality without considering outdoor environmental factors. D. Providing legal action against industries that pollute without engaging the community. Answer: B. Educating residents about the risks of environmental hazards, coupled with advocacy for policy changes. Rationale: a dual approach of community education and policy advocacy is the most effective way to address environmental health risks in disadvantaged communities. Question 27. How can a community health nurse assess and improve the cultural competency of healthcare services in a multicultural urban setting? A. By offering healthcare services in the dominant language only. B. By conducting cultural assessments, offering training for healthcare staff, and incorporating cultural values into care practices. C. By focusing on generalizing healthcare interventions across all cultural groups. D. By minimizing the influence of cultural differences in favor of standardized care. Answer: B. By conducting cultural assessments, offering training for healthcare staff, and incorporating cultural values into care practices. Rationale: effective cultural competency requires understanding and incorporating cultural differences into the care process. Question 28. What is the most critical step for public health nurses to take when addressing health inequities in a community with high rates of unemployment and poverty? A. Offering free health care services to all community members regardless of income. B. Advocating for policies that address the root causes of health inequities, such as access to jobs, education, and housing. C. Focusing only on providing clinical care for individuals with chronic conditions. D. Encouraging individuals to find employment opportunities independently. Answer: B. Advocating for policies that address the root causes of health inequities, such as access to jobs, education, and housing. Rationale: addressing health inequities requires focusing on the social determinants of health that impact a community's overall well-being. Question 29. In a community where health screenings for hypertension are being implemented, which action will best ensure long-term success in reducing the incidence of high blood pressure? A. Relying solely on screenings and ignoring follow-up care and education. B. Incorporating community-wide educational campaigns and providing resources for consistent monitoring and follow-up care. C. Providing free screenings but not addressing lifestyle factors like diet and exercise. D. Offering treatment only for individuals with the highest blood pressure readings. Answer: B. Incorporating community-wide educational campaigns and providing resources for consistent monitoring and follow-up care. Rationale: education and follow-up care are crucial for maintaining the success of screening programs and reducing hypertension in the long term. Question 30. When addressing the mental health needs of a community, which approach would be most effective for a public health nurse? A. Offering medications to all individuals diagnosed with mental health conditions. B. Implementing community-based programs that promote mental wellness, destigmatize mental health issues, and provide access to support services. C. Focusing solely on crisis intervention services without addressing preventative mental health care. D. Focusing exclusively on adults with mental health conditions and ignoring the youth population. Answer: B. Implementing community-based programs that promote mental wellness, destigmatize mental health issues, and provide access to support services. Rationale: mental health interventions should address prevention, community support, and destigmatization to be effective. Question 31. Which of the following strategies would best support public health nurses in ensuring equitable healthcare access for vulnerable populations during a disaster? A. Providing care solely through hospital emergency rooms. B. Ensuring that vulnerable populations have prioritized access to resources and care through outreach, communication, and partnerships. C. Focusing only on the health of the general population and ignoring vulnerable groups. D. Asking the community to find resources independently in disaster scenarios. Answer: B. Ensuring that vulnerable populations have prioritized access to resources and care through outreach, communication, and partnerships. Rationale: vulnerable populations need prioritized access to care during disasters to ensure their health needs are met effectively. Question 32. How does addressing mental health in the context of disaster preparedness reduce overall community vulnerability? A. By encouraging individuals to rely solely on personal resilience to manage mental health. B. By developing comprehensive mental health plans, integrating them into disaster response, and training community members. C. By avoiding discussions about mental health to focus on physical disaster preparedness. D. By offering crisis counseling only after a disaster occurs. Answer: B. By developing comprehensive mental health plans, integrating them into disaster response, and training community members. Rationale: integrating mental health into disaster preparedness is essential to reduce psychological impacts and improve community resilience. Question 33. How can public health nurses reduce the spread of communicable diseases in underserved communities with limited access to care? A. By only focusing on the symptomatic treatment of individuals who seek care. B. By implementing proactive education programs on prevention and providing access to early testing and vaccinations. C. By only providing care to the most symptomatic individuals to limit resources. D. By relying on traditional medicine as the primary treatment option. Answer. B. By implementing proactive education programs on prevention and providing access to early testing and vaccinations. Rationale. Prevention and early intervention through education and vaccination are key to reducing disease spread. Question 34. What is the most effective public health nursing strategy for managing chronic conditions like diabetes in high-risk communities? A. Offering individualized care without considering community-level resources. B. Developing community-based programs that provide education, regular monitoring, and support for lifestyle changes. C. Relying solely on medical treatment without addressing lifestyle changes. D. Encouraging high-risk individuals to seek specialized care independently. Answer. B. Developing community-based programs that provide education, regular monitoring, and support for lifestyle changes. Rationale. Community-wide education and support programs are the most effective way to manage chronic conditions like diabetes. Question 35. Which action should public health nurses take to improve vaccination rates in a community that is hesitant to vaccinate? A. Mandating vaccinations for all residents regardless of personal beliefs. B. Providing community-specific education, addressing concerns, and offering accessible vaccination clinics. C. Relying on mass media campaigns without community engagement. D. Ignoring vaccine hesitancy and focusing on other health issues. Answer. B. Providing community-specific education, addressing concerns, and offering accessible vaccination clinics. Rationale. Tailored education and community outreach are essential to address vaccine hesitancy effectively. Question 36. In managing infectious disease outbreaks, what is the most effective approach for public health nurses? A. Issuing public health warnings without engaging the affected community. B. Collaborating with community leaders and local organizations to ensure accurate communication and compliance with containment strategies. C. Isolating affected individuals without addressing community-wide prevention. D. Focusing on treatment rather than prevention strategies. Answer. B. Collaborating with community leaders and local organizations to ensure accurate communication and compliance with containment strategies. Rationale. Community collaboration ensures effective containment and compliance during an outbreak. Question 37. What is the role of public health nurses in reducing tobacco use in populations with high smoking rates? A. Providing nicotine replacement therapies to everyone who requests it. B. Implementing comprehensive programs that include education, cessation support, and policy advocacy. C. Encouraging smoking as a personal choice without interference. D. Focusing solely on harm reduction for those who cannot quit smoking. Answer. B. Implementing comprehensive programs that include education, cessation support, and policy advocacy. Rationale. A multifaceted approach that includes education, support, and policy change is the most effective way to reduce smoking. Question 38. Which public health intervention is most likely to reduce the incidence of obesity in a low-income urban community? A. Promoting the consumption of processed, affordable foods. B. Implementing community-based programs that increase access to nutritious food and promote physical activity. C. Encouraging individuals to exercise independently without community resources. D. Providing free medications for weight loss. Answer. B. Implementing community-based programs that increase access to nutritious food and promote physical activity. Rationale. Community-based interventions that improve access to healthy food and promote activity are key to reducing obesity. Question 39. How can public health nurses best address the substance abuse crisis in a community with high rates of addiction? A. By offering treatment only to individuals with severe addiction. B. By implementing prevention programs, offering treatment, and providing support for reintegration into the community. C. By focusing only on inpatient treatment facilities. D. By focusing on criminal justice interventions alone. Answer: B. By implementing prevention programs, offering treatment, and providing support for reintegration into the community. Rationale: a comprehensive approach that includes prevention, treatment, and community reintegration is essential to addressing substance abuse. Question 40. In a community with high rates of adolescent pregnancy, which approach would best reduce the incidence of teenage pregnancies? A. Offering contraception to sexually active teens without education on responsible sexual behaviors. B. Implementing school-based programs that provide comprehensive sex education and access to reproductive health services. C. Focusing only on abstinence-only education programs. D. Encouraging parental involvement without providing additional resources for teens. Answer: B. Implementing school-based programs that provide comprehensive sex education and access to reproductive health services. Rationale: comprehensive education and access to resources are the most effective ways to reduce adolescent pregnancies. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.